Well, good morning, everyone. And once again, hello. Welcome to another live this morning. Hope you're having a great start to your day. We appreciate you guys coming on with us, and question and answer Fridays, always fun. Brahim, Sue, good morning. Eric from Ottawa, good morning to you. We appreciate you guys. Thank you so much. Monette, how are you? And Mary from Norwich. Tina, Nova Scotia. Rosa. Morial, Kevin. Oshawa, good morning. Fran from Orangeville. And Wendy from Markham. And Margaret from Lakelet, good morning. Nick from our staff, good morning. And Louise, how are you? And Paul, Edmonton, good morning. Janice, Brampton. And Lori, Niagara Falls. I know a lot of you are on. You don't say hello to me, but you mean to. Chantal, Vince, Barbara, and Marl from Ottawa. Nellie, good morning. And Linda from Chatham, Catherine, Parksville, British Columbia, Barbara, Nova Scotia, Rose, Lighthouse Cove, Ruth Ann, Prince Edward Island, Marcia, Hola from Mexico, Gloria from New York, Deb from Timmins, coast to coast, north and south, Donna, Newfoundland, Judy, and Jean, good morning. Adeline, how are you? Zian, Earlton, Ontario. Linda, good morning. And Cletus, and Louise, and Annette, good morning from New Brunswick. Denise from Oakville. Donna, good morning. And Linda, Medicine Hat, Alberta. We appreciate it. Yoloud, good morning. Jeanette Kapuskasing. Teresa, good morning. And Carol, Moncton, New Brunswick. Carol from Newfoundland, and two more. Grace, good morning. Ruby from Bowmanville. We appreciate you guys. Okay, let's get to the questions. Sandra, what does Dr. Martin think of Kirkland pink Himalayan salt? Well, I like Himalayan salt. Kirkland, that's Costco, right? As far as I know, it's very good. I like Himalayan salt. It's got 84 minerals, trace minerals in it. And I like a real good Celtic salt. The only salt I really don't like is table salt. But, the pink Himalayan is good. Yeah, for sure. Now, the Costco brown, I haven't looked that up. But, I like it. And powdered whipping cream. Well, you know what? I don't know. I haven't looked at it. Okay? Someone, or the folks that are on with us this morning, okay? Maybe give some feedback. I haven't even seen it. I haven't even looked at a label of the powdered whipped cream. So maybe some folks that, if anybody is on there that have, is that a Costco thing too, Sandra? I don't know. Okay. So I won't answer, but I'm hoping somebody else will. Okay. I like Celtic salt. I do. Because it's real salt. Himalayan salt is real salt. Okay? It's got, the idea with salt is it has a lot of trace minerals in it. Sodium chloride, table salt, it's been stripped of its minerals. That's why I don't like it. Okay. Grace, since cortisol is related to anxiety, how can a person avoid medications such as Effexor to reduce anxiety? Well, look, Grace, that's a very, very good question. And look, I'm not going to I never tell a person whether they should or shouldn't take medication. I don't do it. I didn't even do it in my days of practice. What I used to do in my practice, when there was obvious anxiety, okay, I would look, of course, I did it with every patient. I always looked for deficiencies. I was very big on fixing those. I was looking for hormonal imbalances. For example, high cortisol or even low cortisol, where cortisol wasn't balanced. You need to have cortisol. It's just how much you have of that, okay? So you're asking a very, very good question. Someone that suffers from anxiety, remember, Effexor or any of those meds, they're Band-Aids. They don't fix. It's temporary. And again, I'm not telling a person not to do it. I just don't do that, okay? But what I did in my practice days, I looked for deficiencies. And here's the ones that I found were there. And then I'll tell you a little bit about, Grace, what I used to do in my practice in terms of things that I found very helpful, okay, for anxiety, okay? Deficiencies, usually low vitamin D levels, low B12 levels, low magnesium levels, almost invariably with people. And by the way, that was similar. Look, I'm a big guy on, almost without exception, anxiety leads to depression. It's just take a coin and you got a two-headed coin. Anxiety, depression. Same sources, okay? And same deficiencies. I always looked at the gut because you got more hormones in your gut than you have in your brain. Dopamine, serotonin, okay? GABA. Your feel-good hormones, there are a lot of times there was leaky gut involved with that. I used to look at that. I did it holistically. I looked at the, the gut. And I was big on one of the things, okay? Let's say a person's anxious. Well, I had them on my cortisol formula. Now remember, it's a formula. Over the years, it took me years to get to cortisol formula. You name it, I tried it. Ashwagandha, theanine, you name it. Individually. In a combination, I found it to be quite effective. So that could be something that even if someone's on medication could take the cortisol formula. The other thing that I saw, okay, and I got to tell you, dehydration, vitamin W, water. People often were dehydrated. And the connection is again, all of those minerals have a big effect, including magnesium and potassium. And they have a big effect on hormones. Okay? Now, I love meditation. The Bible says, be anxious for nothing, in everything with prayer, supplication, and thanksgiving. Meditate. Prayer. Exercise. Do you know that exercise? I remember I talked about this on a radio show. Oh, gee, it's got to be 25 years ago. A study came out just by putting your running shoes on. Okay? Seriously. Just by putting your running shoes on, getting ready to go out for a walk or go to the gym or whatever would lower your cortisol. It's a study that came out a long time ago. Okay? I used to tell people, put your running shoes on. Go for a walk. Go to the gym. And usually the problem is, especially in anxiety, but even more so in depression, it was trying to get people motivated or moving. It wasn't easy. It wasn't easy because they're already depressed. They don't want to exercise. But I'm telling you, one of the greatest pills you can ever take is vitamin E. I'm big on magnesium too. Okay? Think of magnesium. Relax. Always remember that. Magnesium. Relax. It relaxes your muscles. It relaxes your brain. It relaxes your anxiety. Magnesium. Okay? I love it. Okay. I think I touched it. Thanks for the question, Grace. Rosemary. What can help with lipodemia or lipodema? Okay, let me come back to that because I got to think about that. Ron. Okay, and I'll come back, Rosemary. My wife's name is Rosemarie. So I ain't going to forget. Okay. Since insulin takes glucose out of the bloodstream, and even protein creates a bit of glucose when metabolized, how then can we get low blood sugar? Well, here's how it happens, Ron. Okay? What goes up must come down. And for some people, it comes down too low. Usually when I found this I actually wrote an article in the 70s about hypoglycemia, low blood sugar. But it's always a precursor to high blood sugar. It's always a problem of insulin. Sometimes insulin works so much that it can bring your blood sugar too low. Okay? And you get hypoglycemia. Where I found that the most is in people that had adrenal exhaustion. Their adrenals weren't working properly. And what happens is that their blood sugar, because remember what cortisol does. Cortisol job is to elevate your blood sugar. It's its job. You're waking up in the morning, your cortisol's coming up. It's waking you up. You're in the fight or flight. Ugh. Your blood sugar goes up. It's part of what cortisol does. But what goes up can come down, and too fast and too rapidly. And that's why I used to get my patients eating a lot more protein rather than trying to the yo-yo blood sugar thing, up and down, up and down, up and down, because they were eating too many carbohydrates. And they don't feel good, their blood sugar goes down, then they're reaching for something that gives them a quick fix. I tried to get them off that cycle and get them on a high protein. And that's what you do with a type 1 diabetes. Because type 1 is autoimmune diabetes. It's a different puppy, but they're eating. And it's not easy to convince type 1 diabetics, but they really need protein, big time. But it's hard because they've been trained to, live on chocolate bars, take a juice, do this, do that. And look, I don't want anybody to get into trouble with their blood sugar, but if you eat a lot more protein, eggs, meat, and cheese, that will help to stabilize your blood sugar a lot longer, and it's better for you in the long run. Okay? Thanks for the question, Ron. Sharon, I have been recently diagnosed with apical hypertrophic cardiomyopathy. Okay? Thickening of the heart. Thickening of the, People get pericarditis. People get the sac around the heart can be swollen. The muscle can be cardiomyopathy. Okay? And here's me. Okay? Here's me. What will affect that? Big time. That's where I really like ubiquinol, CoQ10. Because you need to get your battery packs, your mitochondria, the muscle. You got a lot of mitochondria within the muscle of the heart. And CoQ10. Okay, people think of CoQ10, and it's right. It should be thinking of CoQ10. And the best one is ubiquinol, not ubiquinone. And eat steak. Nothing better for your heart than steak. And I would have you on high DHA oil to lubricate. Okay? But CoQ10, really, really important. Louise, my friend's oncologist told her to avoid dairy, cheese, because of the growth hormone. Well, look, I wouldn't be drinking milk, but if they said cheese, they're wrong. Okay? Look, it bothers me because an oncologist, God bless them, okay? I know they mean well, but what they know about nutrition is almost zero. They didn't take it in school. So unless they went out and educated themselves afterwards, and some do, not many, they believe the nonsense, Louise. They believe the lies. And every day I teach what are the lies out there. And when someone tells you that cheese, okay, growth hormone in cow, look, first of all, we don't live in a perfect world, and you can eat cheese till it's coming out your ears. You can have eggs. If you got cancer, here's what they got to worry about. And the oncologist should have been saying this, but they don't, because they don't know what fuels cancer. Louise, you know this. You knew this. You knew it before you asked me. Okay? Unless you're new to the program. It's sugar. Cancer feeds on sugar, not cheese, not dairy. Now look, like I said, don't go to the grocery store and buy milk. Okay? You don't need to drink milk, by the way. Drink water and drink coffee. That will help you to fight cancer. Okay? Now, again, I know they mean well. The growth hormone in cheese, it's a bunch of nonsense. It's a bunch of nonsense. So, okay, what do? You know what to do, Louise. You tell your friend, and you can invite them to listen to about, I got at least 100 podcasts on cancer. At least. Review them. Listen to them. I'll try and convince them that I'm right and their oncologist is wrong. Now, again, I just don't buy it for a second. I have never seen cheese or eggs or meat ever increase tumors in the body. Ever. It's the opposite. It's the opposite. Do I get excited? Yeah. Because I get excited, Louise, because I can't stand. There's two real growth hormones. You know them both. One is estrogen, okay? And the other one is insulin. Knock those down. Okay? Knock those down. Because that's really important when you're fighting cancer. Okay. Diane. Well, here's another question has to do with estrogen. Diane, I am 65 years old and I'm taking Vagifem. Well, Vagifem is estrogen. I don't like it. Okay, Diane? Now, again, I'm not telling you you're not my patient. Well, I'm not even in practice anymore. So I'm just going to give you I'm going to give you an opinion. I never, ever, tens of thousands of women patients, more than that. I never, ever recommended estrogen. Okay, ever. Well, Dr. Martin, I'm in menopause. My estrogen's going down. Yep, I know that. But estrogen is coming out the ears of people, men and women. Every plastic, every air freshener, artificial, everything in your kitchen, everything in your cleaners, everything just about are full of xenoestrogens. I don't want people to go near that stuff as much as possible. You're never going to get away from it completely. And I'm big on blocking estrogen. And I have a menopausal formula to up your progesterone. Because that's the key, is progesterone. Because even though estrogen is coming down, I get it, you're menopause. Estrogen's coming down, it's normal. Men, it goes up. How do you think they get prostate cancer? But women get breast cancer because they have too much estrogen. It's estrogen dominance. It's the deal, Diane, is you got more estrogen than progesterone. So yes, your estrogen's coming down, but the key is to level it out with progesterone. I'm big on that. That's why I created that menopausal formula. Okay? And it's that idea. Okay? So, I get it. I'm on your side. Women that have menopausal, but what they're giving you, Vagifem, is horse's urine. That's how they make it. How can I like that? You're not a horse. You know, it's a growth hormone. I don't like it. Okay? And nobody can convince me to like it. You know? So, and they put these young girls on birth control. And, and they don't even do it. Some of the doctors don't even do it for birth control. They do it because their skin is bad. Oh, I go crazy. You're putting a growth hormone. Estrogen is a growth hormone. It's synthetic. It's made from horse's urine. I don't like it. Okay? But Diane, I'm on your side. And I mean it. Okay? I'm very sympathetic. And, okay. Susan, is it possible to take too many probiotics? No. 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 Okay. And I know I've talked about this before, but it's worth repeating because it's a good question, Susan. Okay? Is it possible to take too many probiotics? Okay, take out one of my capsules of broad spectrum probiotic. Okay? I got them right here, but I don't want to leave my set. Okay? Put in your mind's eye a broad spectrum probiotic. 50 billion bacteria in there. And they're on your side. They're good guys. Probiotics. Pro meaning on your side. They're good guys. We're putting in good guys into your gut. Only for 40 years I've been doing this. When no one was talking about probiotics, I was talking about probiotics. Okay? So Susan, can you take too much? Well, you don't have billions of bacteria in your gut. And by the way, you got bacteria everywhere. Brain, sinuses, wherever you have mucus. Ears, lungs, gut, but the biggest portion of microbiome is in the gut. It's an organ unto itself. The more we study it, the more they realize the gut, from hormones to leaky gut to whatever. Probiotics are on your side. Now, let me just, because people don't realize this. They don't think about it. Okay? They don't think about numbers. Now, let's say, okay, now you and I, okay, Susan, are going to count to 1 trillion. 1 trillion. You got several trillion bacteria in your body. Okay? Somebody said the other day, I read an article, they said, well, you got 100 trillion bacteria in your body. Holy smokes! Who counted? So let's you and I, okay, Susan, we're going to count to 1 trillion. You ready? Bring a lunch. 1, 2, 3, 4. You know how long it will take us, Susan? 33,000 years. It's 32 and change. I'm sorry. But let's round it off. It's going to take us, Susan, to get to 1 trillion. 1 trillion. It's going to take us, if we count, to 33,000 years. Hello? Can you take too much probiotic? No. It's an impossibility. We don't get enough probiotics. You could never take enough. You can't. Okay. Good question, because I'm glad you asked it. What number are you at now? 20? 30 seconds? 33,000 years to get to 1 trillion. You know, in Canada, we have a deficit in Canada. And remember, we're 10 times smaller than the United States. 10 times. Always multiply by 10 when you think of the United States. Canada, our population. The United States is 10 times bigger in population. Okay? Like, you can never, ever take too much probiotic. Ever. Like, I remember studying the microbiome, and we didn't even know anything in those days. I mean, in the 70s, you know what we knew? Like fermented foods. We knew they were good, and we knew they contained bacteria, and we knew they were good guys. Okay? And I knew farmers that used to give probiotics to in their feed for the animals. I said, put some of that stuff in capsules for us. Okay? It's probiotics, guys. You know, it's something that I take personally every day. You can't get too much. And it's the way it is, guys. Okay? It's the way it is. And, you know, unfortunately, medicine hasn't caught up yet to the microbiome. The research that's done on the microbiome is incredible. From cancer to cardiovascular to Alzheimer's to you name it. They haven't caught up yet. It's hard for them. to take in something new, like the microbiome. They don't listen to the father of medicine, Hippocrates, 2,000 years ago, saying all diseases start in the gut. So no, I'm glad you asked the question, okay? You can't take too much probiotic. You can't even give it. You know how much probiotic is in breast milk? Mummy. And, I used to tell mummies this all the time, okay? When that baby is on your breast, not only is the baby getting milk, not only is the baby getting colostrum, which is really important for babies, especially in their first couple of months. Colostrum, okay? Not only is the baby getting lactoferrin, which is really important in the first couple of months of their life, especially, okay? They're getting bacteria, friendly bacteria from mommy's breast, from the nipple. And we live in a society today that is so antiviral, antibacterial, right? Clean everything. Wash everything. Scrub it. This will take 99% of all germs away, because germs are bad. Nah, they're not. They're not. There's good and bad and ugly. But your body you want your body. That's why I tell kids, go play in the mud. Go play in the muck. Get dirty. Put your face in it. People today are so crazy. And it all goes back to Louis Pasteur. The bug, kill the bug, kill the bug. Yeah, okay. I don't want people to get sick either. But they don't talk about the host. They don't talk about your immune system. And a big part of your immune system is those trillions of bacteria. They're on your side. And you can disrupt that. That's why I'm probably the biggest how would I say it? Proponent of when you're taking an antibiotic, you better replace what they killed. And guys, I've been saying it for a century. Okay, half. That's what I've been saying, because I said, look, the problem is when you take an antibiotic, you're killing all the good guys too. They don't, it's friendly fire. And we got a host of new diseases, especially autoimmune. I'm not saying there was never autoimmune, but there was never autoimmune like we see today. Why? Because of the wonderful drug of antibiotics. They're wonderful. They can save your life. They're needed. I'm not against them. But I'm against when you don't replace that bacteria. Because you're getting carpet bombed. That's why there's so much autoimmune. Your small intestine should look like a shag carpet. I keep this right in front of me. It reminds me. This is your small intestine. It's a shag carpet. The problem is when you take antibiotics, you lose your shag and you get that new carpet, and it's not good. It's not good. It just got carpet bombed. And this is autoimmune. This is autoimmune. It starts in the gut. I always aim at the gut. Always aim at the gut. Any autoimmune. Because that's where it started. Okay, I need to breathe. Holy moly, I'm not very far down that list because I'm talking too much. Okay, and Lorna's asking, why would Dr. Martin's probiotics make someone's IBS worse? Well, Lorna, you're weird. Lorna, I'm on your side. Okay. Well, it would be 10,000 to 1. People, if you followed me for 1 day when I was in practice, just 1 day, come with me for a day. And if you saw the amount of people that I fixed their IBS, I didn't fix it. I told them how to fix it. And the big part of that, Lorna, was probiotics and my probiotics. All probiotics are good. All of them. Good, better, best. Well, look, I had to get results. So, Lorna, I don't know. Like, it can happen. One of the things I'm suggesting, and I'm only telling you because I've seen it before, it's not the probiotics that made you worse, it's the fact that you got SIBO, or it's actually SIFO, small intestine fungal overgrowth. And that can take time. That can take time. I would add oil of oregano. Okay? And one of the things that I created my digestive enzymes for was for SIFO. Because SIFO is a fungal overgrowth and it can get in the small intestine big time and really, really create havoc in there. And so medicine likes to give an antibiotic for that. I don't like that because for me, it's not bacterial. Yes, there's bacteria in there. It's like a woman that gets recurring bladder infections. It ain't the bacteria. It's yeast. It's fungus. And actually the antibiotic, God bless them, will make it worse in the long run. And that's why I always try to recommend to physicians, don't use antibiotics unless you have to. If a patient has got a lot of pain and burning, you don't want that thing to go up into the kidneys. I get that. But be very, very careful because it's fungal. You're developing a fungus infection. Same thing in the small intestine, Lorna. Now, I don't know you individually as a case, but I'm just giving you some ideas, okay? And we appreciate the question. And, I'm not going to finish today. Okay, let me get to Linda. Linda, have I ever told you how much we love Lindas? Listen, Linda, listen. Okay, Linda's going, I've watched Dr. Martin's talk on 5 types of dementia. Okay, I like that. Well, it was me. But let me see if I can get that little drawing. I got it in my notes. Here, I have it right here. Linda, there it is. Okay? The 5 forms of dementia. Okay? Alzheimer's, 50%. Okay? Lewy body. And Parkinson's is a form of dementia. Okay? Dementia being the overarching disease of the brain, but Alzheimer's is 50% of it. So Alzheimer's is a form of dementia. Vascular dementia. Small vessel, they call that. Okay? 20%. Well, look, can it be reversed? Depends. But here's what I would do. Big vascular. Okay? Blood vessels. Lay off sugar. Sugar destroys blood vessels. Toxic. 1. 2. Make sure, vascular. Make sure you're getting enough lubrication. The brain is made up of DHA fat. Why do I love DHA? I love omega-3, but why do I love specifically DHA? Because your brain's made up of that. 60% of your brain is DHA. Plus, DHA is so stinking anti-inflammatory. It lubricates those blood vessels. Okay? I'm big on you know me and pine bark. Somebody asked me about pine bark. Hold on, I'll get that in a second. I'll finish with that. Pine bark extract does a lot of things, but one thing it does, it crosses the blood-brain barrier. That's really important. And it elevates your nitric oxide. What is nitric oxide? Opens blood vessels. Water. I'm so big on water. Water. Blood supply. It's a river of life. Okay? The life of the flesh is in the blood. You need vata, water, vitamin W. So many people are dehydrated. 80-90% of the population, they have no idea. Because they don't have a little red light coming off and saying, I am dehydrated. Okay? Now, who was asking me? Let me finish with this. I can't remember who it was. I think I'm going to have to do Monday. Is there any benefit of adding pine pollen? I'm telling you, to my daily supplements. Well, I like pollen, but you're talking about adding it. I don't know. Listen, I've been around the block so many times that you have no idea. I've heard of everything. And pollen, I never disliked it, and pine bark pollen, I can't say I've heard of that one. But pine bark extract is probably, and I mean this, guys, one of the supplements that's been researched the most is pine bark extract. I mean it. And what it does to elevate your glutathione, what it does to elevate your nitric oxide, which I just talked about, I don't know. To me, it's like a multivitamin on steroids. I love Navitol. I had such great success over the years with it. I mean, for 30-something years. Consistent. I love it. It's hard to beat that. If you want to take something else, I'm not against that. Okay? But don't replace your Navitol. Can you take it? Sure. If you think it's helping you, Brad, you go for it, man. But, good, better, best. I always believed in that. Okay? What's best? Okay. I got a pile of questions I didn't answer. And I'm going to do it, I think, again on Monday, okay? Because I feel sorry for people. I pontificate. Oh, yeah, he forgot. Okay, Kevin, I got it. He forgot to go back. I'll go back. I'll do it on Monday. Lipedema. Lipodema. Which one was it? Okay, I didn't forget. Okay, so guys, we love you. You know that, eh? Okay. Thanks for coming on, guys. We appreciate it. Share this. And we love you sharing it. And we know that when you share it, Facebook shares it even more. Okay? And then get people who can't tune in with us live to go to our podcast, the Doctor Is In podcast. See the sign? See the sign? There. The Doctor Is In podcast. Okay, guys, we love you dearly. Talk to you soon.